Hello, my name is Joyce. In this video, I'll be illustrating how to initiate a secondary infusion. Before we begin, I'll ensure the medication is compatible with primary infusion solution. In this case, we are looking at vancomycin. That is what we are supposed to give our patient. Okay, then I will proceed to the patient's room. I'll introduce myself, I'll wash my hands, and I'll provide privacy. I'll don my gloves. I'll ask my patient their full names and the date of birth, and then I'll compare with my man to see whether I have the right patient. Then I'll go ahead and explain my procedure. Before I begin, the medication that I have checked the medication 2 times before I came to the room, and then I'll go ahead right now and check the medication the 3rd time to compare with the order that the provider has given. Then before administering the medication, I'll assess my client's sites. This is the site that we have on the arm. I'll assess my client's sites for any infiltration or bleeding, and I'll ask my patient whether my patient has any pain. Okay, right now my patient has no pain. Then I'll get a short secondary tubing. I'll get a short secondary tubing infusion out of the packet. Right now it's already out of the pocket. This is out of the packet. This is gonna be my secondary tubing. It is out of the packet. Then I'll spike the bag with the secondary administration set and insert it in the needleless cannula. Sorry, but this is already inserted and spiked, so there is nothing else I can do. It is already spiked, but before you do all that, you need to spike it to the end of to the cannula, to the end of the secondary tubing, and I'll make sure that the clamp available on the secondary tubing okay, this is the clamp that I have for the secondary tubing. I'll make sure that I close it. I'll close it. Okay. Then, because this is already clamped, but I'll make sure that I'll clean the injection port with my alcohol swipe. This is the alcohol swipe that I'm going to use. I'll clean the injection port of my primary tubing. This is now my primary tubing port. I'll open it up and clean it with alcohol wipe, and I'll be able to insert the needleless cannula of my secondary tubing into the primary tubing. But before I do that, after cleaning, I'm gonna flush with my normal saline. This is the normal saline that I have. I'm gonna flush it into my primary tubing. Okay, I'm done flushing. Then I'm gonna connect with my secondary. So I'm connected. Okay, then I'll make sure I'll clear the tubing of the medication by opening the clamp. This is my medication tubing. I'll open the clamp, temporarily place in the secondary bag. This is gonna be my secondary bag. I'll place it lower than the primary bag. I'll place it lower than the primary bag, allowing the primary solution to flow retrograde into the secondary bag tubing, into the primary tubing. This is called the back priming. So what I'm talking about, this is my secondary, and then right now my primary is already running, but I'll make sure now my secondary is lower than my primary. Okay, but I'll make sure that the fluid is flowing. Right now you cannot see, but you will be seeing the bubbles that the secondary solution is moving. Okay, so when that is done, I'll hang my secondary bag. I'm gonna hang my secondary bag up on the IV pole, and then I'll use an extension hook to lower my primary bag, which is already running. This primary bag, I'm gonna put a tourniquet so it can be able to lower. It can lower. That what this means is my piggy bank will be higher than the primary bag. Then I'll be able to see the backfills until the secondary tubing chamber is a third full. You'll see a backfill, and then I'll make sure I clamp the secondary tubing. So I'll clamp the secondary tubing. In most cases, you'll find the device, the infusion device. You may program that. You will program the secondary settings that you have into the infusion device that you have used. But right now, we don't have that device with us. Then I'll open the clamp for my secondary clamp. I'll open the clamp, the secondary bag tubing. Then the solution will be able to flow from the secondary tubing. Then I'll be able to check my primary infusion, and it will be able to resume at its set rate when the secondary volume has been infused. When the secondary bag is empty, I will then readjust the rate of administration in the primary solution to desired flow, unless the infusion device controls this, but I'll be able to do it manually. Then after that, I'll change the tubing every 96 hours. That is about 4 days. Okay, so when I'm done with all that, my secondary tubing is running and everything is done. I'll lower the patient's bed. I'll place the collar in reach, and then I'll make sure the locks, the brakes are locked. I'll remove my gloves. I'll wash my hands, and after all that, I'll document my procedure. Thank you so much. That is the end of my video. Thank you.